Hello, everyone, and welcome to this little Lunch and Learn webinar. Today, I'm going to be covering sort of an Adëeva supplement training part one, as advertised. And it really is just sort of an overview of sort of how the Adëeva product line is designed, the research behind it, how some of these products work synergistically to improve certain health outcomes and prevent some problems. So I appreciate you sitting in. I'm going to get started right away because we have a lot to cover. So without further ado, let's get started. What I'm going to cover today are these 11 Adëeva supplements. Now, Adëeva has another 10 or 11 supplements beyond this, which I'll review in January sometime. But I thought today we would cover the first 11, and these are sort of a lot of the main staple supplements that a lot of practitioners have an interest in. So we'll start with the Adëeva all-in-one multiple vitamin. You're probably familiar with it. The reason I created this is because prior to this product existing, I used to buy a multiple vitamin, then I bought extra C, then I bought extra E, then I bought extra selenium, then I bought a B50 complex, then I took extra vitamin D, and then I would get calcium, magnesium. It was like 7 or 8 different bottles I was buying to get all these nutrients sort of into my body at dosages that the research shows would be beneficial. So the first thing that I formulated was the Adëeva all-in-one multi that gives you the 1,000 milligrams of C, the 400 IUs of vitamin E succinate, which is the most important form of vitamin E when you look at how it's involved in blocking certain steps related to cancer, which I will show you shortly. And then, of course, selenium and zinc and everything else that you see, including lycopene and lutein. So I just put it all into one bottle to make it more cost effective and more convenient for patients to be able to access these nutrients without buying 7 or 8 different things. To ask somebody to take 7 or 8 different bottles, the compliance is going to be low. Ask them to just buy one product and take that supplement every day is, you're going to get better compliance and they're going to get the best bang for the buck because the meaningful dosages of everything are in there, as you can see. I'm sure you've seen this before, including the vitamin E succinate, which I'm going to touch on again and just sort of review for you. And including lutein and lycopene. Lutein, for the back of the eye to help reduce risk of macular degeneration. Lycopene for the prostate gland, the cervix of the uterus, and even breast tissue. Lycopene concentrates there and shows some meaningful benefits. So yesterday, I actually did a full webinar for consumers on the research behind a high potency multivitamin. And so that particular webinar will be available on our website soon if you want to watch it, if you haven't seen it yet. But really, a high potency multivitamin like that is based on human clinical studies to show it can have these kinds of benefits of slowing aging, decreasing free radical damage, helping to prevent steps in Alzheimer's and Parkinson's, slowing or preventing macular degeneration, slowing the development of cataracts, even helping to prevent age-related hearing loss, helping to optimize immune system function, helping people recover from serious infections, decreasing recurrence of breast cancer. Studies are showing this now, the Shanghai breast cancer study and other ones. Slowing brain atrophy, which is related to memory loss as you get older, an adjunct to mental health treatment. People who are resistant to depression medications often improve when you give them certain B vitamins that help synthesize serotonin, dopamine, norepinephrine, and so on. And preventing mental health problems in elderly people who are often deficient in folic acid and especially vitamin B12. Preventing osteoporosis. Maternal stores of certain nutrients are very important for the child's IQ if a woman becomes pregnant. Also for wound healing and maintaining normal taste acuity as you get older. A lot of people don't taste their food very well as they get older. Their wounds don't heal properly. These are often marginal deficiencies. Maintaining night vision, dark adaptation. Nutrients are required. Supplements make a big difference. And also for blood sugar regulation, especially with respect to things like chromium. So a high potency multivitamin like the one I just showed you has application for all 15 of these clinically important health issues for humans. So really, it's a supplement that, replaces 7 or 8 different bottles. And you say, how come I can't find something like this in a drugstore? And that's because in a drugstore, they want people to buy 7 or 8 different bottles. I mean, they're there to sell as much product as they can. So they're not going to carry a product like this because it's going to sabotage the sale of a lot of their other products. But in terms of what's best for the patient, this is a much better way to go about it. One bottle replacing 8 different bottles. It's less expensive, and the compliance factor is going to be greater. So with respect to vitamin E succinate, I'd just like to touch on a couple of things. It's just so important. Almost no multiple vitamins have vitamin E succinate. I don't know why. But again, it's blocking receptors that, like the epidermal growth factor receptors, that overstimulate the genes to cause cells to divide quickly, which is you get an overexpression of that receptor in about 30% of all of breast cancer and other cancers as well. Vitamin E succinate has been shown to tone down that receptor function. It also has been shown to reactivate these death receptors so that immune cells can actually get cancer cells to commit suicide, because often it's hard to get a cancer cell to commit suicide when the immune system is attacking because they desensitize these receptors. Vitamin E has been shown to resensitize them. And vitamin E succinate also sequesters the BCL2 so that if the tumor suppressor gene P53 identifies as the cell's becoming a cancer cell, it can release the Bax protein, which will lead to apoptosis by sort of breaking apart the mitochondria. But BCL2 acts like a roadblock. But if you can sequester that and get rid of it, then that pathway continues. So you get this great anti-cancer effect of vitamin E succinate in experimental studies. And a lot of cancers, you get an overexpression on the surface of these epidermal growth factor type 2 receptors, or HER2 receptors. You hear about this a lot in many breast cancer cases. And vitamin E succinate has been shown to help tone those receptors down, so you're not getting this constant stream of impulses causing cells to divide quickly. And it inhibits vascular endothelial-derived growth factors, so tumor cells can't form new blood vessels to feed the tumor, so the tumor can't expand as easily. So this has anti-angiogenic behaviors in all these experimental studies. And then more recently, we saw that, not only that, but it's only vitamin E succinate, not other forms of vitamin E, that cause rapid production of free radicals selectively within cancer cells, triggering them to undergo apoptosis while being non-toxic to normal healthy cells. That's unbelievable. It has this effect only in cancer cells, to get them to kill themselves by generating so many free radicals. Studies show that if cancer cells are able to protect themselves with free radicals, with antioxidants, then they're less likely to undergo apoptosis. So experimentally, and this is an important issue, a cancer patient is undergoing treatment. If you start giving them antioxidants, it can actually, we think, inhibit the effectiveness of the chemotherapy drugs and/or radiation. But vitamin E succinate actually is more synergistic in its behaviors because it doesn't offer the cancer cell antioxidant protection. It actually generates free radicals in a cancer cell. So what they're saying is that vitamin E succinate has the opposite effect of these other sort of antioxidants in a cancer cell. It increases the accumulation of free radicals within cancer cells selectively, which leads to cell death. How does it do it? It binds to complex 2 in the mitochondria, preventing the binding of coenzyme Q10, so you can't shuttle the hydrogen electrons down the electron transfer chain. So CoQ10 becomes unable to transfer those electrons, and thereby it releases the hydrogen electrons into the cell, and the unpaired electrons interact with oxygen in the cytoplasm, creating reactive oxygen species like superoxide anion, which accumulate and trigger programmed cell death. When cancer cells are overwhelmed by free radicals, they commit suicide. And vitamin E succinate has been shown to selectively do that in cancer cells. So this mitochondrial disruption killing effect of cancer cells has recently been demonstrated in these mouse models of breast cancer, in which many tumors showed overexpression of the HER2 receptor. The positive HER2 receptor breast cancer phenotype is known to be highly aggressive and a stubborn form of cancer to kill. But vitamin E succinate was able to even kill those types of human breast cancer cells that had the HER2 overexpression. That's significant. So in 2005, they said, let's try this in a patient that has malignant mesothelioma, because we've seen experimental studies show that in mesothelioma human cells, that vitamin E succinate has this effect and it kills them. So they tested it in a human trial, because we know that malignant mesothelioma is a form of lung cancer, of course, is caused by exposure to asbestos, highly resistant to radiation chemo. There's really no treatment for mesothelioma that's effective. So in this single case study, administering vitamin E succinate to a patient with malignant mesothelioma, the researchers stated The data revealed a significant clinical benefit with vitamin E succinate therapy, causing a reduction in tumor volume and improved the well-being of our subject who had a lethal type of neoplastic pathology. There are no drugs so far that can do that. This was published in Lancet in 2005, and it was based on the experimental evidence showing that vitamin E succinate kills mesothelioma cells. So here's all the research on vitamin E succinate. It's a very impressive form of vitamin E. And in 2021, we saw this new experimental evidence with human cervical cancer cells showing that it inhibits the ability of the human cervical cancer cells to put a receptor on the outside called CD47, which normally would inhibit macrophages from coming and destroying the cancer cell. So by inhibiting the CD47 expression on the cancer cell, it allows the macrophages to come and destroy the cancer cell. It allows the immune system to do what it's designed to do. So, because having a lot of CD47 receptors on a cancer cell inhibits the ability of the immune system to attack the cancer cell. So another way that vitamin E succinate has now been shown to increase the ability of other therapies and to trigger certain mechanisms that help to get rid of cancer cells should they be forming. So we need more human studies to verify all of this, but the experimental evidence in the early studies that we have with this mesothelioma patient is very impressive. So it's really only in the Adëeva multiple vitamin that you're going to see vitamin E succinate at a meaningful dose. It's very hard to find vitamin E succinate anywhere. I don't know why that is. But for me, in my body every day, I want 400 IUs of vitamin E succinate to be doing some of these things behind the scenes, at a meaningful dose. And then there's nature's essential oils. So that was the Adëeva Multi. It's the foundational product. If that's the only product you ever recommend to your patients, you just sort of make it a standard thing that you give to every adult that you see. That alone is a huge attribute to their overall health profile. Just that one thing. If that's the only thing you ever do. But then there's the Adëeva Nature's Essential Oils, which I think people should also be using in conjunction with the multi, because it's a high yield fish oil. It's not like low levels of EPA and DHA. It's very high levels of EPA and DHA with flaxseed oil, which is 57% alpha linolenic acid, another omega-3 fat, borax seed oil, 22%. And it has all these applications to reduce inflammation, for cardiovascular health, of course, even with respect to arrhythmias and fibrillation and the stickiness of platelets, for brain support, of course, slowing down the rate of cell division is linked to prevention of cancer in many studies. Also having skin that is actually softer and smoother and protecting even against sunburn and helping to improve eczema and some other skin conditions, helping to manage PMS. For vision, you need the DHA for the rods to make rhodopsin, and for other aspects with respect to the retina. It improves insulin sensitivity by reducing inflammation around the insulin receptors. It's been part of the treatment for non-alcoholic steatohepatitis or fatty liver disease, which is very common. 25% of the world's population now has fatty liver disease. And also experimental studies show that it can re-lengthen telomeres, which is related to longevity and healthy life expectancy. And, a woman who's pregnant, if she's getting more DHA, she's going to pass that on to her child for brain development, higher IQ in her offspring. And then it's been shown also to be helpful for asthmatics to decrease the overall inflammatory processes going on in the respiratory passageways. So just what you already know, of course, is that arachidonic acid becomes these inflammatory prostaglandin series 2 and leukotrienes series 4 in white blood cells, whereas EPA from fish and fish oil becomes these anti-inflammatory prostaglandin series 3 to reduce inflammation. But the story is a little bit bigger, of course, because if you can build up more dihomo-gamma-linolenic acid by ingesting GLA, what you get from borax seed oil, as that concentration builds up, you convert more of this to prostaglandin series 1, which is also anti-inflammatory, along with prostaglandin series 3 from icosapentaenoic acids. Remember that flaxseed oil with its alpha linolenic acid can be converted to EPA and to DHA, and the EPA can then become prostaglandin series 3 that reduces inflammation and also in white blood cells, the leukotrienes, which are also anti-inflammatory. But dihomogamma-linolenic acid becoming prostaglandin series 1 is also very important. So let's look at that. So normally, linoleic acid can become GLA, can become dihomogamma-linolenic acid. And as that builds up with the right antioxidants and B vitamins and minerals, that helps this enzyme convert it to prostaglandin series 1. But as we get older and with certain health conditions, some of that conversion doesn't occur because the delta-6 desaturase enzyme becomes defective. But by supplementing people with GLA oil, like from borage seed oil, you can get that back on track and optimize your prostaglandin series 1 synthesis. And I use borage seed oil because it's the most cost-effective way to do it. Remember too that icosapentaenoic acid and docosahexaenoic acid from fish oil also become not just prostaglandins and leukotrienes that are anti-inflammatory, but also resolvins, these different molecules that also reduce inflammation, resolvin E and resolvin D from DHA. So DHA also has direct anti-inflammatory effects. It's not just it has to be converted to EPA to form prostaglandins. DHA has its own direct anti-inflammatory effects. So then there's glucosamine joint formula. So of course at age 40, cartilage erosion can start. So I created, glucosamine joint formula with glucosamine, MSM, quercetin, bromelain enzymes. These things are reducing inflammation, and glucosamine, of course, is supporting joint cartilage production. I think after age 40, everyone should do what I did when I was 40, start taking at least 1 capsule a day to prevent joint cartilage erosion. But if the person has osteoarthritis, they're going to need 3 capsules a day or maybe 4 capsules a day. And Health Canada, because of the evidence for this product is so strong, they allow us to say it helps to relieve joint pain associated with osteoarthritis. It helps to protect against deterioration of cartilage. Those are Health Canada allowable claims because that's what this product does. So what you want to do is prevent that healthy knee as people get older from becoming, the cartilage erosion and the osteoarthritic changes that you then see on X-ray. So, you should be helping patients prevent that from happening, and also helping them, if it's already started to happen, to slow the process down or halt it completely. Because what normally happens, of course, when you're younger is that glucose gets into the chondrocytes, and some of that's going to become these glycosaminoglycans and proteoglycans like chondroitin sulfate. And the process occurs this way, right? Glucose becomes glucose 6-phosphate, and then to fructose 6-phosphate. And then that enzyme, the fructose 6-amide transferase enzyme, converts fructose into glucosamine. But as you get older, that enzyme becomes much more sluggish. You don't make glucosamine like you used to. So once you have the glucosamine, normally it gets acetylated, and then that acetylated form of glucosamine helps to form hyaluronic acid that you need for the viscosity of the joint fluid in the synovial fluid. And some of the acetylglucosamine becomes N-acetylgalactosamine, which you need to make chondroitin. So as soon as you can't make glucosamine anymore, you can't make these downstream glycosaminoglycans and proteoglycans. So here's what chondroitin is supposed to look like: glucuronic acid attached to N-acetylgalactosamine. But if you can't make this monosaccharide, then the rate at which your cartilage is broken down is faster than the rate at which you can synthesize it. It's just that simple. So chondroitin sulfate is a series of repeating disaccharides. It just becomes a long chain like that. And it's sort of the mortar between the bricks in your cartilage. So, cartilage has like collagen and elastin and fibrin tissues, but the mortar between the bricks is chondroitin sulfate, has a sort of bottle brush appearance. So here's the collagen in the joint cartilage. Here's a serine backbone, and these bristles are the chondroitin sulfate. And it's not only that it's there, but it's also pulling water into the cartilage to give it the shock absorbing effect. So when your glucosamine synthesis declines, you're making less hyaluronic acid, and you're also making less the proteoglycan chondroitin sulfate. So not only is the cartilage thinning, but it's dehydrating, and that's when cartilage starts to crack and chip and break off. You get joint mouse activity. So you want to preserve not just the structure of the cartilage, but also these functional capabilities of the cartilage to be shock absorbing and not brittle. So that glucosamine in conjunction with MSM, which is an anti-inflammatory, quercetin, which is an anti-inflammatory, bromelain enzymes, which is an anti-inflammatory, gives you this fast-acting anti-inflammatory effect combined with this great sort of joint cartilage preservation effect. I think everybody over the age of 40 should take 1 capsule a day. That means the bottle will last them 3 months. You know, it's not like this is a huge expenditure. They spend $30 or $35 every 3 months to protect their joints. I mean, to me, it's just, how do you not do that? Then there's cardio essentials at age 45. I think people should be paying attention to this. It has the CoQ10 with hawthorn and also quercetin. At age 45, maybe 1 capsule a day. As you get older, because your CoQ10 synthesis drops off more, I would take 2. If a person's on a statin drug like Lipitor or Crestor, minimum 3 capsules a day. If they have high blood pressure, as I'm going to show you, 2 to 3 capsules twice a day can help to bring their blood pressure down in many cases. They have dilated cardiomyopathy, you know, they're under physician supervision, so you can't just throw things at them like this, but I have seen it help people with dilated cardiomyopathy as long as they're under physician care. Remember that if they're on digitalis or digoxin, they can't be taking hawthorn. So this 2007 review of CoQ10 and high blood pressure was published in the journal Hypertension. They said, look, we looked at 12 clinical trials, 3 randomized control studies. 1 was a crossover. There were 8 open trials. And the randomized control studies, the systolic blood pressure in the treatment group was 168 before, and after CoQ10 treatment, 151, right? A decrease of like 16.6 millimeters of mercury systolically, and no significant effects. It's hard to make drugs that can lower blood pressure that much. The diastolic blood pressure in treatment was 103, and then it went down to 94 after treatment, a decrease of 8.2 in systolic and diastolic pressure, no significant side effects. In the crossover study, systolic blood pressure decreased by 11 and the diastolic pressure by 8 with no significant side effects. In the open trials, the systolic pressure was 162, and then it went down to 148, a decrease of 13.5 millimeters of mercury. The mean diastolic pressure was 97, went down to 86, a decrease of 10. So they said, look, we conclude that CoQ10 has the potential in hypertensive patients to lower systolic blood pressure by 17 millimeters of mercury and diastolic pressure by 10 without significant side effects. When they make drugs to lower blood pressure, they can get it to lower it by 5 points. That's a huge win for them. That's why they stack one antihypertensive drug on top of the next in some of these patients. And here you see CoQ10 reducing it significantly more than that. And one of the ways that it does it is by releasing nitric oxide. When you release nitric oxide, you dilate the blood vessels and you make platelets less sticky, less chance of heart attacks, and you decrease the risk of arrhythmias. All these things related to getting the right amount of CoQ10 back into the body as people age. Because as you age, your CoQ10 synthesis drops down significantly. Look how much less there is in the heart muscle. It's significantly less. And then if you go on a statin drug, look at how your CoQ10 levels drop. Then if you go off the statin drug, it comes back to a certain degree. And the ejection fraction of the heart, because the CoQ10 is required to make energy in the heart muscle, but the heart muscle starts getting weaker. So yet people who are on statin drugs have to have CoQ10 because they're blocking their own synthesis of it. So when you're on a statin drug, yes, you're blocking the production of cholesterol by blocking the HMG-CoA reductase enzyme, but you're also blocking the main pathway to make ubiquinone, which is coenzyme Q10. So as that CoQ10 gets blocked, the heart muscle gets weaker, the ejection fraction starts to suffer. You're setting yourself up for congestive heart failure. So just the age-related change in CoQ10 synthesis, coupled with a lot of people on Lipitor and Crestor, puts a lot of people into a CoQ10 deficiency that goes totally unrecognized. Then in 2018, we saw this incredible study out of Sweden, where they took elderly patients, gave them 200 milligrams a day of CoQ10 and 200 micrograms of selenium for 4 years. And they said, we're seeing 12 years later, we're seeing an unbelievable lasting effect. So this is the first 4 years, but after 12 years, they're still seeing a 40% reduction in cardiovascular mortality, including in those who had high blood pressure originally, or ischemic heart disease, or impaired cardiac function, even in all these high-risk individuals, given CoQ10 and selenium. It decreased these cardiovascular mortality in these individuals by 40% in older subjects. So where does hawthorn fit into the story? Hawthorn helps the mitochondria make more cyclic AMP. From cyclic AMP, CoQ10 can help make more ATP. And ATP is the ultimate energy source for everything, including for the heart muscle to contract. And hawthorn also increases nitric oxide release in the endothelial bed of coronary vessels. So the blood vessels dilate, you get better circulation, less risk of angina, and has natural blood pressure lowering effects because of the release of nitric oxide. Again, the caveat here is that you can't take hawthorn if you're on digitalis or digoxin. 2013 review of hawthorn and cardiovascular disease prevention said this: currently, evidence is accumulating from various in vivo and in vitro studies that hawthorn extracts exert a wide range of cardiovascular pharmacological properties, including antioxidant properties, positive inotropic. That means it allows the heart muscle to contract with more force, preventing congestive heart failure, anti-inflammatory, anti-cardiac remodeling, anti-platelet aggregation, so you don't get platelets clumping together and forming abnormal clots, vasodilation, lowering blood pressure, endothelial protective effects, reduction of smooth muscle cell migration. These are the things that cause atherosclerosis, protective against ischemic reperfusion injury, where the heart stops and they start it again after bypass surgery. And then this hyperreperfusion, usually there's a lot of free radicals that damage the heart muscle. Hawthorn's been protected, anti-arrhythmic, lowering lipid levels and decreasing arterial blood pressure. I mean, I like CoQ10 with hawthorn. This is the reason why. Clinical studies have shown, placebo-controlled studies have reported both subjective and objective improvement in patients with mild forms of heart failure using the New York Heart Association's categorization of heart failure of type 1 to type 4. They're saying in type 1, type 2, and type 3 heart failure, we're seeing people improving when you give them hawthorn. Same thing with CoQ10. The heart muscle, the ejection fraction can get stronger. It also helps in people that have high blood pressure and people with high cholesterol and high triglycerides. So it's a fantastic combination. The reason I put quercetin in there is because quercetin is a very good blood vessel anti-inflammatory. Higher blood quercetin levels are linked to less cardiovascular episodes in certain studies like the Zutphen elderly study. So I added some additional quercetin into Cardio Essentials. Then at age 50, of course, the immune and detoxification systems weaken. So I created, this product called Immunodetox Prime with reishi mushroom extract and astragalus, milk thistle, and the indole 3-carbinol. And I think that after age 50, you would take 1 to 2 capsules a day for prevention. Also, by the way, if you happen to be prone to canker sores, as I used to be, this product will almost stop them in their tracks, just won't get them anymore. At the first sign of a cold or a flu, I normally take 4 capsules twice a day, along with Adeeva Oregacept capsules. During the pandemic, I've also added sort of a mushroom blend that has a whole bunch of different mushrooms in it that I mix into a little bit of pomegranate juice. Because after age 50, of course, the immune and detoxification systems get weaker, so you're more prone to infection, more virulent infections, and you're more prone to cancer as well. So why does the immune system get weaker? Well, because in the aging process, the thymus gland undergoes involution, so the T lymphocytes are less intelligent. Also, the accumulated free radical damage to immune cells leads to some immunosuppression, but antioxidant supplements can help to guard against that. That's why the multivitamin is so important. And the neutrophils produce less respiratory bursts to kill bacteria, viruses, fungus, cancer cells. And again, higher vitamin C has been shown to help overcome that. But still, you want your immune cells working more intelligently. And that's where reishi mushroom and astragalus come into play. Other things weaken the immune system: certain drugs, compromised immune states, lack of sleep, alcohol, certain drugs, smoking, using THC and CBD also weaken immune system function. Overtraining with your workouts, stress, depression, hopelessness, these things all weaken the body's immune system. So here's all the references on that if you want to read up on it. But you know that as you get older, cancer rates start to increase: colon cancer, breast cancer, prostate cancer. And one of the reasons is that the immune system is not doing as good a job at killing cancer cells off. And in the detoxification pathways in the liver, they're becoming more sluggish. So you need things to keep those detoxification pathways primed. You need antioxidants from the multivitamin. You need the B vitamins from the multivitamin. But milk thistle and the indole-3 carbinol play an important role. Here's milk thistle in step 1, detoxification. And here's the cruciferous vegetable indole-3 carbinol in phase 2 detoxification. Very, very important products to help keep liver detoxification working optimally as you get older in conjunction with the Adëeva high potency multivitamin. So this is just sort of an overview of what those things do and why as you get older it becomes critically important to start adding them. So even WebMD with respect to reishi mushroom, what do they say? Reishi mushrooms are among several medicinal mushrooms that have been used for hundreds of years, mainly in Asian countries for the treatment of infections. More recently, they've also been used for the treatment of pulmonary diseases and cancer. Medicinal mushrooms have been approved as adjuncts to standard cancer treatments in Japan and China for more than 30 years, have an extensive clinical history of safe use as single agents or combined with chemotherapy drugs. Because you want your immune system working more effectively, and chemo drugs weaken your immune system. This is one of the things people can be used, but forget about already having cancer. You want to try to prevent it. And that's where these things become a very important. So reishi, when you look at the different medicinal mushrooms related to immunity, I'm going to show you the studies on this, but medicinal mushrooms contain unique ingredients called, especially the beta-D glucans, also triterpenoids, but the glucans are really important. Analytical methods show that especially the beta-glucans can not only stimulate immune cells to work more efficiently, but they fit perfectly into the receptors on macrophages in the gut. So when you swallow them, the gut macrophages actually take the beta-glucans in. They have receptors for it. The binding of these constituents to immune cell receptors generates a response from immune cells that heightens and greatly optimizes its ability to combat foreign viruses, bacteria, and cancer cells. As one researcher stated, medicinal mushrooms have been shown to have the ability to stimulate the immune system, modulate humoral and cellular immunity, and potentiate anti-mutagenic, anti-tumorigenic activity, as well as rejuvenating the immune system weakened by radiotherapy and chemotherapy in cancer patients. In other words, in patients undergoing radiation and chemotherapy, medicinal mushrooms brings their immune system back. But it also just does it in people who are aging after the age of 50. Get your immune system working at a more youthful level. So this is, the image of how they sort of represent it. Here's a macrophage in the gut swallowing a beta glucans in its receptor, and then it spits out fragments of that to stimulate other immune cells to actually up their game so they can produce antibodies and attack tumor cells and also viruses. So once those beta glucans activate to the receptor, you get this huge immune activation. So all your immune cells are now working at a higher level to kill viruses, bacteria, fungus, parasites, and identify cancer cells more effectively. So I would suggest, if you're interested in this topic, to read these 3 research review papers. They are absolutely sensational. With respect to astragalus, the Memorial Sloan Kettering Cancer Center website summarizes astragalus. It says the studies show that medicinal constituents in astragalus can boost immune system competency and exert direct antiviral effects. During a pandemic, it's good to have some direct antiviral effects, in my opinion. A 2012 review of all astragalus studies showed the many ways that astragalus enhances immune system function, including boosting the release of interferon, interleukin-2 from key immune cells, which are well-established strong boosters of immune function. So reishi mushroom extract with astragalus is a great 1-2 combination. And then milk thistle, which we know helps to support liver detoxification, but it also has immune boosting properties as well. It increases lymphocyte proliferation, it boosts secretions of immune modulating cytokines, particularly interferon gamma, interleukin-4, interleukin-10, which are required responses when the body's facing a virus that is trying to take hold and start an infection. The researchers state, our study has uncovered a novel effect of milk thistle on the immune system. The immunostimulatory effect may be of benefit in increasing immunity to infectious diseases. And then the indole-3 carbinol from cruciferous vegetables, broccoli, Brussels sprouts, cabbage, bok choy, turnips. But that indole-3 carbinol attaches to what are called the aryl hydrocarbon receptors on the adaptive immune cells, which stimulate the cells to respond better to fight viruses and foreign cells that enter the body. It helps the T lymphocytes proliferate faster and improve ability of other immune cells to ingest and devour any threatening viruses or bacteria that is deemed threatening to the body. So you see that in journals like Pharmacological Reviews, you have these types of articles being published. So what it looks like is this: the indole-3 carbinol diffuses into certain immune cells, attaches to the aryl hydrocarbon, which goes to the nucleus, which tells the nucleus to upregulate its game of these immune cells in terms of a better immune response, a healthier immune response that brings homeostasis to the body. So this product, Adëeva Immunodetox Prime, has that standardized grade of reishi mushroom extract, astragalus at a standardized grade, milk thistle, 80% silymarin content, and additional indole-3 carbinol, because people don't eat cruciferous vegetables every single day. Even I don't get them every single day. So I don't want one day to go by without having the detoxification effect, the anti-cancer effects of indole-3 carbinol, and its effects on immune regulation. So I usually recommend that people over the age of 50 take 2 capsules a day. But during the pandemic, I think almost every person over the age of 16 might consider doing that. Again, first sign of symptoms of an infection, I would be increasing the dosage. Here's a cancer cell under an electron microscope. These are cytotoxic T cells that would be coming there, secreting certain chemicals and blowing the cancer cell up. And that's when the immune system is working properly, that's what happens, because you make 1 to 3 cancer cells every day. You need to knock them out. But as soon as the immune cells are compromised in any way, and just the aging process alone can do that, as well as the other things that I showed you, drugs, compromised immune states, lack of sleep, overtraining, alcohol, smoking, all these things can weaken the immune system. You need to ensure that you've got the optimization back. These are macrophages looking for cancer cells in the body and identifying them and knocking them out. So Immunodetox Prime, certainly in people over the age of 50, I think it makes great sense to take 2 capsules a day. And then, during the pandemic, maybe you should broaden that out. If you're starting to feel some prodromal symptoms, I usually start to take higher doses until I'm feeling better. Then there's memory support, Adëeva memory support to help prevent memory loss after the age of 55 with CDP, choline, phosphatidylserine, huperzine A, Bacopa monnieri. But also it's important with that supplement to be giving, to encourage people to take 2 capsules of lecithin each day to get additional choline into the bloodstream so you can get more crossing into the blood, to blood-brain barrier to the brain. And it works best with essential fatty acids that contain DHA, like Adëeva Nature's essential oils. That's been shown to make this product work better because you can more quickly make acetylcholine under those circumstances. I've reviewed that in other webinars. So again, here's how it works. That when you have choline available to brain cells, they can convert it into the memory chemical acetylcholine. And again, notice serine can become choline and then become acetylcholine. But after the age of 55, it's harder to get choline into the brain. So the studies show that only certain types of choline cross into the brain effectively, like CDP choline and phosphatidylserine, which can become a secondary source of choline. So there's a little carrier that brings choline across the blood-brain barrier, but it becomes much more sluggish as you get older. The studies show that by taking CDP choline, you can keep choline getting into the brain and making phosphatidylcholine from which the body can make acetylcholine. Phosphatidylserine is a great brain phospholipid, but it also becomes a secondary source of making more acetylcholine as well. Bacopa monnieri is used in the Indian medical system to preserve memory function by improving nerve conduction. And huperzine A, used in China, slows down the breakdown of acetylcholine, so you raise your acetylcholine levels effectively. So if you want to read up on that research, the most recent research, I've provided some links for you. Well, I'll make these slides available to you after the webinar so you can do your own research on this. But these are the most recent studies on all of these nutrients showing their effectiveness in memory support and other prevention, even of certain other neurodegenerative conditions like Parkinson's possibly. Then there's prostate 40 plus. So men over the age of 40, of course, should be taking this product. It's the Cadillac product to help preserve prostate health, in addition with other, prudent lifestyle strategies. But look at the prostate cancer incidence in Canada. It's one of the worst in the world, like 1 in every 7 or 8 men. It's the second or third leading cause of prostate cancer death in men in Canada. very, close to colon cancer risk. If all men quit smoking, then prostate and colon cancer would be the leading causes of cancer death, and both of those are highly preventable. So you see, as men get older, the risk really increases. But we've seen studies in the Journal of the National Cancer Institute that show that 75% of prostate cancer is preventable through better dietary practices, lifestyle practices. So what happens in the aging process after the age of 40, the body converts more testosterone into the dangerous form of testosterone called dihydrotestosterone, which causes prostate cells to divide at a faster rate, leading to enlargement. And when cells divide quickly, they make more genetic mistakes that lead to cancer. So all of the scientific evidence points in that direction. Once you build up too much DHT, the cells are dividing faster. If you form a cancer cell, it spreads faster. And DHT also causes free radical damage to prostate cells, which directly cause some genetic damage. So what it looks like is this. The testes are releasing testosterone. The testosterone gets into a prostate cell. After the age of 40, it more rapidly is converted into DHT, or dihydrotestosterone. That's the dangerous form of testosterone. You want to block that if you can, and that's what those herbs do in prostate 40 plus. But also from the adrenal glands, they're converting cholesterol into androstenedione and DHEA, and the sulfated form of DHEA. That also gets through these androgen receptors, and then some of that can form testosterone and go on to form DHT. So the great thing about prostate 40 plus is that it's blocking the conversion of testosterone into DHT, but it also blocks androgen receptors to a certain degree. So less of these precursors can even get into the prostate cell. That's critically important. There are no drugs that can do that. So what do the ingredients do that are in prostate 40 plus? They decrease the conversion of testosterone to DHT by blocking the 5-alpha reductase enzyme. They also are an androgen blockade. They decrease also the uptake of not just testosterone, but also androstenedione and DHA. They also block too much estrogen from getting into prostate cells, because estrogen slows down the breakdown of DHT. Also in fat cells, beta cytosterol blocks the conversion of androstenedione into estrone, so the fat cells are releasing less estrone in the first place. Also, some of these agents, like the flavonoids, have anti-angiogenesis effects, like vitamin E succinate. I showed you that earlier. Some of these, in experimental studies, we see some of these ingredients cause human prostate cancer cells to commit suicide. We have all kinds of evidence in medical journals that these nutrients can reverse enlarged prostates that are just mild to moderately enlarged. And some of these ingredients have been used also is in the adjunctive management of prostate cancer. But don't wait to get prostate cancer or enlargement. Start protecting your prostate before this happens. So after the age of 40, take 2 capsules. If you're a man, take 2 capsules a day to prevent these things from happening. You want to maintain throughout your entire life a PSA blood level that's below 1 nanogram per milliliter, as my blood level is, which ensures that you'll never develop prostate cancer. And that's where you want to be on the spectrum in a cancer that is like the second or third leading cause of cancer death in the country that you're living in. Then there's women's hormonal balance with black cohosh, soy extract, gamma-rosinol. Very, very effective in 80% of cases of managing menopausal symptoms. You see the drop in estrogen and progesterone as women get older. You're familiar with this. So how do these nutrients work? Well, these are the phytoestrogens in black cohosh and in soy isoflavones. Their structure tricks the hypothalamus into thinking there's sufficient estrogen in the bloodstream, which in turn stops sending peptides to the anterior pituitary gland to release higher and higher amounts of follicle-stimulating hormone, luteinizing hormone, which otherwise trigger menopausal symptoms, along with then triggering adrenaline release. So if the hypothalamus thinks there's enough estrogen in the body and progesterone, it doesn't overstimulate the pituitary gland to fire off super high amounts of these hormones that cause menopausal symptoms. The gamma-rosinol directly inhibits the oversecretion of follicle-stimulating hormone, luteinizing hormone, to control hot flashes. It also has a cholesterol-lowering effect for postmenopausal women, which is great. In younger women who have PMS, these phytoestrogens help to improve the balance between estrogen and progesterone, because often there's a high estrogen to low progesterone ratio that's causing PMS, uterine fibroids, fibrocystic breast disease. These nutrients help to create a new balance, and the black cohosh also enables in younger women a chance to produce higher amounts of progesterone that they're often not able to produce on their own. So that's how it even helps younger women that have some of these other problems. Then there's Adëeva bone support formula with, all these ingredients you would think you'd find in a bone support formula. With the addition of the icarian flavonoid, which is a flavonoid found in the what's called the horny goatweed herb or epimedium herb, which has been shown to increase osteoblastic activity and decrease osteoclastic activity, even in postmenopausal women, helping some of them recapture bone that they've lost in later life, which is incredible. So when you combine the Adëeva multiple vitamin with bone support, you're getting 1,100 milligrams of calcium, 1,800 IUs of vitamin D, 500 milligrams of magnesium, the 60 milligrams of the icarian flavonoid has been shown to be effective in postmenopausal women, with silica to help maintain collagen stability, with boron, with B complex also to keep homocysteine levels low, which can damage bone, the vitamin C for collagen synthesis, and also copper for collagen synthesis in bone. Those are the beams that hold everything together. So some individuals, if their diet is good and their bone density is good and they're exercising and their vitamin D levels are great, just need the Adëeva multivitamin. But if they're in a more high risk category for osteoporosis or osteopenia, or they already have it, then I would add bone support on top of that. Remember that 1 in 4 women over the age of 50 and 1 in 8 men over the age of 50 in Canada develops osteoporosis. It costs the Canadian healthcare system, $2.3 billion a year. That was back in 2010. Very expensive in the US. 30,000 hip fractures annually in Canada. The direct cost is about $35,000 per hip fracture. Osteoporosis affects 16% of women and 7% of men over the age of 50. 75% of hip fractures in Canada occur in people over the age of 75. But 21% occur in people just 50 to 74 years old. They're in a high risk category already. So you want to put in the prevention steps before it gets to this critical stage, because women's mortality rates from osteoporotic fractures are greater than the combined death rate from breast and ovarian cancer. Right? They fracture hip, they go in the hospital, they can't move, fluid collects in their lungs, becomes a pooling ground for bacteria, they get pneumonia and they die. So, you should prevent this from happening on just about every single patient that you see, because up to 20% of women and 30 to 40% of men die within the first year after that hip fracture. Because men are more elderly, that's why it claims more lives for men after the fracture. But nearly 1/3 of women and 1/6 of men will fracture their hip in their lifetime. That's ridiculous. So as a health practitioner, this should be high on your radar to prevent that. You don't want these crazy compression fractures in the thoracic spine that lead to the Dowager's hump and people needing walkers. If it happens in the hip, of course, becomes prone to fracture, and then person can't walk and they get pneumonia and they're done. Then there's Sleepy Naturals, very proud of this product, with melatonin, 5-HTP, GABA, and Bacopa monnieri. I put Bacopa monnieri in here because I think it's a good idea to start getting some Bacopa monnieri even at age 40 when you would start getting melatonin. It's a great brain antioxidant as well as a memory preservation ingredient. So you know that melatonin levels start dropping, and by the time you're in midlife, your melatonin levels are low. It's not just that you can't sleep well. Melatonin is a very important brain antioxidant. It modulates the immune system as well, and has some direct anti-cancer properties and indirect anti-cancer properties, which they were reviewed in 2015 in the International Journal of Cancer and Clinical Research, where they looked at the influence of melatonin on the immune system and on cancer. So melatonin has great immune modulation effects, also has some tremendous effects in interrupting the biological steps linked to cancer. So as you get older, that drop in melatonin leaves you wide open to compromised immunity and, we think, less cancer protection. In the National Institutes of Health, February 3rd, 2021, looking at melatonin and COVID-19, they said this: melatonin is another supplement that has been identified as a potential antiviral agent against COVID-19 using computational methods. It has also been highlighted as a potential therapeutic agent for COVID-19 due to its documented antioxidant, anti-apoptotic, immunomodulatory, and anti-inflammatory effects. Notably, melatonin vitamin D and zinc have attracted public attention because they were included in the treatment plan for President Trump when he was in George Washington hospital being treated for melatonin. They gave him being treated for COVID-19. They gave him melatonin as part of the therapy because the powers who are really following this subject know that this has tremendous potential. So what about 5-HTP? In one study, people who took 5-HTP went to sleep quicker and slept more deeply than those who took placebo. Remember, 5-HTP helps the body make more serotonin, which gives you a greater feeling of well-being, shuts off appetite, and helps to improve sleep quality. Researchers recommend 200 to 400 milligrams at night to stimulate serotonin, but it may take 6 to 12 weeks to be fully effective. 200 to 400 milligrams is a really high dose. If you're going to combine 5-HTP with melatonin and GABA, you can use much lower doses, as I have done in Sleepy Naturals. So when you combine it with GABA, when you combine 5-HTP with gamma aminobutyric acid, animal studies using caffeine challenge tests and trying to keep the animals awake with caffeine. They're saying, hey, when we give them GABA and 5-HTP, it reveals an inhibitory effect when you have this combination on the sleep-wake architecture in the caffeine-induced sleeplessness. Oral administration of combined GABA and 5-HTP increased total sleep time and non-rapid eye movement sleep compared to the control group, which is highly impressive. In conclusion, using video tracking to measure behavior as well as electrophysiological approaches, we identified the two neuronal substances, GABA and 5-HTP, given individually or in combination, enhance the quantity and quality of sleep in caffeine-induced sleepless model systems. So the combined evidence suggests that caffeine-induced sleepless model is a valid system for investigating the inhibitory and sleep-promoting effects of non-pharmacological remedies, and the combined GABA and 5-HTP precursors can be helpful in patients with sleep disorder who have mild or moderate insomnia, which is a lot of people as they get older. The conclusion, the combined effect of GABA 5-HTP could be a potential medication to act at low doses with fewer side effects than sleep aid medications on behavior and neurochemical properties, published in 2018. So Sleepy Naturals is melatonin with low-dose 5-HTP and GABA, along with an additional antioxidant protection for the brain, Bacopa pulmonare, which also has effects on preserving memory function as well. It's a nice, gentle, non-toxic sleep aid. How much do you take? Well, at age 40, you don't need much. You need maybe one capsule an hour before bedtime. Age 50 to 60, 2 capsules usually will do it. So now I'm in my mid 60s. I still take 2 capsules. Sometimes I'll take a third. If I take a third, I'm really going to sleep super well that night. And then after age 70, you might want to consider 4. But it's a bit of trial and error. The advantages of this over Valium and benzodiazepines and sleep aid drugs, there's no dependency, there's no cancer risk. These things are brain antioxidants. They slow down the rate of cell division of breast and prostate cells as well. It preserves immune system function. It supports serotonin levels. It helps with memory preservation, and it may help prevent biological steps related to neurodegenerative conditions. I'm saying that especially about the melatonin research. So you can read those references I provided for you right here if you want to read further about that. So finally today, I just want to touch on Nature's Relief. It's a very powerful combination of anti-inflammatory natural agents that can be used to help in people that have, autoimmune diseases that affect the joints, like rheumatoid arthritis and ankylosing spondylitis, psoriatic arthritis, tendonitis as well, a person with a mild disc herniation or bursitis, advanced osteoarthritis, you might want to include this. That has, of course, the curcumin, boswellia, white willow bark extract, and ginger. These things working synergistically are quite powerful. So, of course, curcumin is inhibiting, 5-lipoxygenase and cyclooxygenase, helping to prevent the conversion of arachidonic acid into these inflammatory prostaglandins. But it also inhibits other tumor necrosis factor alpha seen in autoimmune conditions related to the inflammatory cascade. It's been tested in some head-to-head studies against phenylbutazone with good effects. Very few, if any, side effects. A great comprehensive review was published in 2012 that you see in the journal Pharmaceuticals. You might want to read that paper. It's phenomenal. But the long and the short of it is that curcumin has many anti-inflammatory properties, blocking many steps that are related to inflammation. It even has some anti-cancer effects that are quite significant, and also in the brain, some neuroprotective effects. So again, these articles sort of summarize that. But for me, blocking the cyclooxygenase enzyme, and the lipoxygenase enzyme here and the cyclooxygenase enzyme here to decrease less arachidonic acid, these inflammatory modulators. If I'm treating people with musculoskeletal conditions, that becomes very important to helping to block the inflammatory process so they can reduce their reliance on anti-inflammatory medications. And also in rheumatoid arthritis, I won't get into details here, but there's this Wnt beta-catenin pathway that's active in rheumatoid arthritis that curcumin has been shown an ability to inhibit the Wnt pathway, so you don't have constant inflammation and joint activity that's actually leading to more inflammation and cartilage destruction. So curcumin's also has an ability in this situation to block this particular pathway that's active in certain autoimmune conditions. Then with boswellia, it's this resin from the boswellia tree, has great anti-inflammatory properties, especially important in blocking the lipoxygenase enzyme. Clinical studies show good results in people with OA and rheumatoid arthritis, no major side effects. Some recent studies, 2014, pain-reducing effects of boswellia. The 2020 review was 7 randomized control trials, looking at a total population of 545 patients with osteoarthritis. It says, based on current evidence, boswellia and its extracts may be an effective, safe treatment option for patients with OA, and the recommended duration treatment of boswellia and its extract at least 4 weeks. So they're saying in 4 weeks, you start to see significant change. 2020 study also involving patients with knee osteoarthritis also showed very good results. Boswellia is a really underappreciated anti-inflammatory that I put into that product with curcumin. And of course, white willow bark extract, which contains salicylic acid, blocking the cyclooxygenase enzyme, also has a natural analgesic effects as well. When you look at all the recent clinical studies that I gave you to look at here in the references, significant effects on osteoarthritis, and more recently, even in rheumatoid arthritis. And then ginger root, we think about ginger sort of being good for people with upset stomachs and nausea and motion sickness. But the gingerols in ginger also block cyclooxygenase and the 5-lipoxygenase enzyme, with some good clinical efficacy now in osteoarthritis, rheumatoid arthritis, myalgias like fibromyalgia, with very minimal side effects that people report. So again, the clinical studies, I've given you the references right there. So I thought today I would just sort of give you that high-level view of these supplements. Many of you are already using some of these. You're familiar with them. I've shown you research on this before in some other webinars where I've featured certain clinical conditions. I just wanted to give you sort of my mindset as I went about formulating these products, the research that I was seeing that sort of fortified my decisions to include certain nutrients and change things over time to try to keep the formulations up to date. So I hope that was helpful. I thank you very much for tuning in today.